Brain tumors can occur in any part of the brain. The recent advancements have made a huge difference in the treatment of these tumors. Fundamentally, the tumors can be very easily diagnosed today with an MRI scan. Even the smallest of the small tumors, regardless of the location, can be identified very easily. Its location, size, effect on the brain, direction, everything can be well known through a proper MRI. And there are certain special studies, which is the contrast study, can tell us how vascular the tumor is. DTI, or a diffusion tensor imaging, can really identify what are the structures it is trying to disturb inside the brain. We can study with MR angiography the blood flow around the tumor, and of course 3-dimensional imaging can help the surgeon to locate accurately where the tumor is and what area it is affecting. Based on that, the surgery can be very accurately planned, called microneurosurgery. In addition to that, a lot of gadgets have come in to the operating room of a neurosurgeon's armamentarium to help to remove these tumors completely, safely and quickly too. The neurosurgery has become shorter and more precise with these gadgets. Primarily, one is a craniotomy instruments, where we make a small opening into the skull which can be closed back very nicely. A microscope can enlarge the magnification and show the structures within the brain and surrounding the areas very effectively. Navigation can real-time guide a surgeon to accurately go to the tumor area and also help us to go around and remove the tumor completely. Intraoperative imaging, either an intraoperative MRI or intraoperative CT scan or intraoperative ultrasound, can help us to see that the surgeon removes the tumor completely. And the awake craniotomy is another technique where a person is awake, especially when you are operating in a very eloquent areas of the brain, for example, tumor located in the hand or the leg area or the speech area, where you can preserve the functional ability of the brain. Without disturbing that, we can remove the tumor completely. And there are other intraoperative monitoring techniques, as well as the endoscopy, stereotaxy, and all these will help the surgeon to reach there effectively. And there are intraoperative lasers and different types of bipolars and ultrasonic surgical aspirators, where we can burn the tumors, break the tumors into small pieces and remove them without disturbing and applying any kind of traction on the surrounding brain. So that the overall effect is the tumors can be accessed very accurately, removed completely, safely, and the surrounding brain remains as normal as possible, so that at the end of the surgery, the person is functionally active and recovers well. And moreover, any brain tumor, regardless of the location, when you remove it completely, that's the one which is going to decide about the outcome of the tumor. And of course, most of the benign tumors, when it is removed completely, it's a cure. We don't need to do anything more. Unfortunately, for the malignant tumors, depending upon the histological pathology report, we may have to decide on a radiotherapy or a chemotherapy, depending upon the type of the tumor.